Okay, so this morning it's Annoying Research Day. I'd like to talk a little bit about vitamin D. Okay, vitamin D is a critical part of our body. It's important in a lot of things, and recent research has shown that people with high levels of vitamin D in their bloodstream have less cancer, less heart attack, less stroke, and less death. So, big deal. We never knew how many people had low vitamin D because the test itself was so expensive. 10 years ago, 20 years ago, it might cost tens, hundreds, or even thousands of dollars to get a vitamin D level because it was so hard to measure. Recently, with advances in laboratory science, vitamin D levels cost pennies. So we now have data on hundreds of thousands, even millions of people in the United States and around the world. And one of the findings is many of us, a majority of us, have low vitamin D levels. Okay? Good, normal, high vitamin D levels, less bone fractures, less osteoporosis, less heart attack, less stroke, less death, less cancer. And lots of us have low vitamin D, and maybe that's because we're all living indoors. Remember, vitamin D is created through the sun's reaction on the skin. Okay, and we have all been following the advice of dermatologists of staying indoors and not being outdoors and not getting the sun. So lots of Americans, excluding those from San Luis Obispo, California, are pale because we've been indoors, we've been covered up. My job, I work in a windowless room. So lots of Americans and lots of people around the world have low levels of vitamin D. And low levels of vitamin D, unquestionably, bad for you. Okay. Low levels of vitamin D, more hip fractures, more falls, more death. Okay, so here's a study reported this morning with the same annoying results as that last study we talked about. So you can do it right now with me. But that's what we're going to say at the end. The title, Annual High-Dose Vitamin D and Hip Fractures in Women. In other words, all these vitamin D levels, if they're high, better bone, fewer falls. So they said, we know that vitamin D is associated with lower hip fractures, but previous trials of giving tablets of vitamin D have been mixed as far as the results. Questionable. Because maybe those women were just not following the instructions, not really taking their vitamin D, these physicians doing this study said, well, I got an idea. Let's give them one shot of a dose that's equivalent of what they would take for the entire year. So these doctors in Australia randomized 2,317 women who were just living outdoors, mean age of 76, at risk for fracture, and they received a single oral dose of vitamin D, 500,000 units. 500,000 units of vitamin D, one dose. Okay? And then they followed them for 3 to 5 years, some of them getting that for every year. Okay? And almost everybody they checked was taking more than 800 milligrams of calcium. So, the other thing is that the mean baseline vitamin D levels were low, around 20 micrograms per milliliter, which is a little bit low. And at 1 month, 3 months, and a year, the people who got the one dose of vitamin D doubled or tripled their blood level of vitamin D. So it worked. They got the vitamin D. They gave vitamin D, their blood levels went up. During the 3 years of treatment that they had to follow, hip fractures more common in those who got the vitamin D. We don't want to go outdoors and be in the sun, excluding those of us from San Luis. We want to stay indoors, and those who got the vitamin D had more hip fractures. Falls, just falling. more common if you got vitamin D. Again, we're faced with a difficult finding here. Vitamin D, from the natural healthy mechanism of getting it in the sun, good for us. A giant tablet of vitamin D may actually not be good and may actually be harmful. Now, does it mean that you should move to California and every Saturday spend 8 hours baking in the sun until you burn to a crisp? No, I don't want dermatologists listening to this video and saying, oh, that Dr. Rutledge. But I think the general recommendation now is every single day be outdoors in the sun with as much of yourself exposed to the sun as possible for at least 20 minutes every day. So a good way to do that is get a dog and take him for a walk. But be outdoors in the sun every day. And this other research goes along with the B12 and the B vitamin research, that just taking B vitamins is not, just taking any kind of vitamins by itself is not the solution. In this case, the conclusion is not just eat good, but it's get out. Like your mama used to say, get out and go play outside.